So guys, since we've done these Gates Foundation stories the last couple of weeks, I thought I'd share with you the questions that I emailed Gates Foundation, their media response team, as well as a few of their members who I have emails from. So here's just what I sent Peter Dole and the Gates Foundation staff and the media response team. Dear Peter Dole and Gates Foundation staff, we have an upcoming article regarding the Bill and Melinda Gates Foundation's undisclosed involvement in clinical trials. We have a few questions for you. According to the Association of Clinical Research Professionals Code of Ethics and Professional Conduct, researchers are encouraged to publicly disclose relationships and potential conflicts of interest in publications and avoid dual-use relationships that could impair professional judgment. Question number 1. What was your criteria for ongoing engagement in clinical trials regarding hydroxychloroquine? Some clinical trials researchers were contacted once and never again, while others indicate you had an ongoing, closed, and confidential relationship. Number 2, who was your contact at the University of Minnesota regarding the $3.2 million donation to provide effective, accessible, scalable treatment for COVID-19? Number 3, what effect does such a large medical benefactor as the Bill and Melinda Gates Foundation have on small and new researchers whose clinical trial results could negatively impact your organization's investments and other areas of public health? Number 4, why was Peter Dole, a vaccine expert, closely involved in Dr. David Boulware's prophylaxis research when the Gates Foundation was devoting significant efforts towards vaccine research and development in 2020? The point of that question is, why was a guy who works on vaccines distracting himself on hydroxychloroquine when at the same time Gates Foundation was pursuing vaccine research? Wouldn't you want all hands on deck for that? Number 5, does the Bill and Melinda Gates Foundation have any statement regarding the current whistleblower complaint to the IRS regarding your current tax exemption status in Miami? Number 6, in an email to Dr. David Boulware on June 3rd, 2020, in response to Dr. Boulware's study, claiming results showed no efficacy for hydroxychloroquine on COVID-19, Peter Dole stated, "Now the fun begins," continues. Considering the global trauma occurring across the planet at the time that was written, what did that statement mean? Number 7, why did the Gates Foundation seek closed and confidential relationships with researchers in regards to hydroxychloroquine? Number 8, would you be willing to release all emails from the Bill and Melinda Gates Foundation staff from 2020 to the public so that any concerns about your foundation's involvement in clinical trial research can be alleviated? Number 9, do you have a comment on the latest allegations that your organization funded in part the effort to block Robert F. Kennedy's nomination for HHS Secretary? No response. They didn't have time to respond to me, but they did have time to stalk me. I'll put these questions up at brokentruth.tv as soon as I can. Please subscribe for more, because if you followed me this far, you'll probably be back for more. Thanks, guys.